Hi, everyone. Thanks so much for joining us today. We're going to talk about the latest thinking on birth control methods and some insight on which options might be right for you. And to join me today, I'd like to introduce Molly Kenward. Hi, Molly.
Hey, Brittany.
Molly is a nurse practitioner at UCSF here in San Francisco, and she's so passionate about women's health, in addition to being one of my very good friends, and she is going to be walking through her presentation for about the next 20 or 30 minutes, and then she'll be doing a Q&A afterwards. So please make sure to add your questions into the Q&A section below, and we will review them after she finishes. All right, let's get started. I am going to share my screen so she can walk through her presentation.
Am I sharing my screen or you're sharing your screen?
I've got it. Are you able to see it?
I can see it, but I don't know if people can see me.
I think we're probably good to just get it started.
Okie dokie.
I think you'll see a version of you.
Yeah, I think if anyone is live with us and can't see my face, please send us a message in the Q&A so we can change things around.
Great.
No objections, and I will begin. Hey everyone, I'm Molly, as Brittany mentioned, one of her close friends, and I'm very, very excited to be here today to talk about something that I'm really, really passionate about. As Brittany mentioned, I'm a nurse practitioner at UCSF in San Francisco, and one of my favorite things about my job, and is usually the highlight of my day, is when I have a patient that I'm seeing for reproductive counseling. And so I will try not to be too shaky in my voice because I get very excited about these subjects, or talk too quickly because, again, there's just so much to say. But I just wanted to say this is great topic to talk about. It is massive. It is enormously complicated, but we'll try to keep to the basics and mostly go over some really new and exciting forms of contraception that are on the market today. So Brittany, if you want to move to the next slide. Thanks. So I have no disclosures, and my views and opinions are my own and not those of the University of California, San Francisco. Right, next slide. Great. So let me just finish it on my end here. 1 second. Perfect. So the first slide here, a little bit about history. So before we can talk about birth control, I think it's really important to back up and talk about two things that are super helpful to know and review about birth control. And that is the history and, of course, a little bit about our menstrual cycle and anatomy. And the reason I talk about history is that, well, basically it's based on our title, the latest on birth control and what's right for you. Because for a long time, it wasn't up to us. And sadly, to this day, there are still many people in organizations who want to tell you what's right for you. I know, massive groan. I could spend a whole day talking about this. As I said, it's massive and complicated, but nobody wants that. So I'll try not to lose my mind or the time and go into some of the highlights about the history, because they do form a bit of our views of how we see birth control, what we've learned about birth control, and also how we have access to it as well. So just to quickly go over the late 1700s to 100 years later, so the 1800s, I just really want to highlight that a long time ago, we had a lot of babies. I mean, 8 live births was the average for women in the 1700s, and then later came down to about 3. Still seems like a lot for me, but a lot of that had to do with the agricultural revolution, us moving to rural areas, but a lot of it wasn't because of abstinence or people having less sex. It really was down to birth control. There is a huge common misconception that birth control methods emerged in the 20th century as a result of increased scientific technology and the loosening of the puritanical morals that have shaped our early policies and laws. But that's not the case. Basically, birth controls that we know today, many of them have been around for hundreds, if not thousands of years. Up until the 1950s, we had vaginal sponges, condoms, we used the withdrawal method, diaphragms, fertility tracking, even early IUDs. So birth control wasn't invented and tested by science in the 21st century. It was tested and practiced by women who passed their knowledge through folklore medicine for generations and generations. And so basically, from the 1900s to now, I have all these different dates here, and I will definitely can go and get lost in these. But morality in medicine really, in the 1900s, a lot of modern medicine tried to tell women or people with a uterus, when they should have children and when they shouldn't. A lot of this was based on the eugenics movement. That was kind of a ideology to deal with population increase. And the idea about when women and people with a uterus should have children was based on the ideas of society, not a woman's choice, not a person's choice. And so that guided a lot of the idealisms about physicians, medical communities, telling people what they should have and shouldn't have, and when they should have children, or if they should have children, and how many they should have. And I think a lot of that still gets passed down today. And then going into the 1915s, there was a lot of sterilization laws. There was more later down in the line. And this is a big thing for communities of color. Eugenics believe that a lot of people, poor people, Black and brown people shouldn't have children. And a lot of them, when they had their first child, were sterilized without their consent. And this also has been a huge problem. And it wasn't until I think the 1970s, late 1970s, that became mandatory for people to give consent before having sterilization, which is crazy. Margaret Sanger wrote this book called What Every Girl Should Know. It was a kind of beginning of women understanding about contraception and having children and making choices. The Depression, women were in the workplace. Planned Parenthood was the sister clinic, the development clinic of Margaret Sanger's work early in 1916, and finally was developed in 1942. In 1958, we had banned the sale or distribution of contraception. So even looking 1958, we couldn't get any forms of birth control. And in some states, and basically in Massachusetts, where the birth control was invented in the 1960s, it was a felony to distribute, to sell, or give information about birth control.
A felony?
A felony. You could be
know any of this. Wow.
A felony to put into jail if you had to do anything to do with birth control in the 1960s. I put here the Dalkin shield. I don't know if you remember this very Star Trek-y IUD that was first made. A big thing about this is there has been a lot of harm that birth control has caused to women. About 7 women died. There was over 300,000 law cases, or I think there was litigation cases against the Dalkin Shield company. And it was because the FDA did not have any litigations or approval on medical devices. And because of this, it was the first time in history that they mandated the FDA approve medical devices for use. The Doctors Against Pill, Case Against Pill was a publication that was about the use of the birth control pill. The estrogen was very high when we were getting sick and very unwell and having a lot of complications. And a lot of people fought and took it to Congress and were able to reduce the amount of estrogen in pills. Roe v. Wade, as we know, was until the 70s that unmarried people could access to birth control. And we can see that even the IUDs, Plan B, emergency contraception, wasn't available to the 90s. And even the early 2000s, we couldn't get emergency contraception, EC, that's what's there, over the counter. Even till today, Trump versus Pennsylvania was a recent law that was passed that basically allowed large organizations not to distribute birth control based on any ethical or religious basis. So we're still kind of fighting this fight today. So next slide.
It's so shocking how recent this stuff is. I really, it feels so ubiquitous now. So that's a really great perspective. I mean, I feel very appreciative now.
Yeah, I know. When I was doing this, my jaw was just perpetually dropped and on the floor, just thinking the 70s didn't feel that long ago, and our parents' generation, for me, to know that people didn't have access to what we know today as birth control, and that we are still fighting it today. So a quick view of our anatomy. I know a lot of us know this, but some people don't. Our, our whole, the anatomy of the female, people with the uterus is internal. And so basically I think it's great to go over because it's good to know a little bit about the hormones that are used in hormonal birth control and what they're actually doing. So we have two ovaries. From the ovaries, the fallopian tube, which collect the eggs, and that's connected to the uterus. The uterus, the inside lining is called the endometrium. The bottom of that uterus is called the cervix. Then you have the vaginal canal, and then the outside world. So the menstrual cycle, this is this diagram here, this picture here. I think many of us have seen in a textbook. I got this from a textbook. I remember looking at this forever when I was younger and going, nope, it doesn't make sense to me. It's too complicated. And when I personally had tried fertility wellness method, it was really helpful to look at this, be like, oh, I can only get pregnant during ovulation, this peak time. And this is what happens during this. And this is when there's one with temperature changes. You can see on the second from the top of like when your temperature spikes. And I found this really helpful for me to understand how that method worked. And also when I took combined oral contraception, knowing what was happening with my cycle, my body, because we're really mimicking stuff that is natural, things that happen naturally to us. And so the beginning of the menstrual cycle starts with, guess what, bleeding. And so the far left, you see bleeding happening and low amounts of hormones. And then slowly what happens is the hormone estrogen increases. There's a slow release of LH and FSH. And this is a communication between three main organs. There is the hypothalamus in our brain, pituitary in our brain, and then the ovaries. And basically what happens is when the endometrium starts to come off, which is our period, we start developing the egg, and that's a growing follicle. And that's why it's called the follicular phase. And we have a slow increase in estrogen and the FSH and LH. And then estrogen peaks. This causes LH to peak and to jump up, and that's what causes a release of the egg. The next phase is called the luteal phase. And so basically the little shell where the egg was released, so where the follicle was, egg is gone, it's going down the fallopian tube, there's a shell left, and this is basically going to be, it's going to be putting up a lot more progesterone. And what that's doing is it's stopping another egg from being produced, and it's causing the endometrium to basically grow. And that growing of the endometrium stabilizes it so you can have implantation. And that's what we're doing with the hormonal birth control, is we're mimicking that period of time. And that period of time is similar to pregnancy for a lot of people, high amounts of progesterone. And that's what prevents us from getting pregnant. We're not releasing an egg, so nothing can actually be fertilized. And the endometrium is stabilized as well. And without the estrogen usually makes it grow a little faster. You can see there when the estrogen goes up, starts growing it. The progesterone kind of keeps it more stable. And that's why with people who are on progesterone only, we have these kind of more intermittent bleeding and the less bleeding. And we'll go into the side effects shortly. So that's a quick and dirty kind of go through the anatomy and understanding of how our cycle works. Next slide. Oh, back one. Perfect. This is something else you all might have seen. It's in a lot of medical offices if you ever go there or anyone talks to you about birth control. And I think it's a great, clear representation of what's available. And what I don't like about a lot of these is they all seem to be kind of organized by how efficacious they are, how good they are at preventing pregnancy, which obviously for a lot of us is really, really important. And one thing that's not on this slide is there is a range. And so a lot of the ranges is dependent on how we use contraception, birth control. There's two things you'll see in the literature or if you're reading about it, and there's perfect use and typical use. And perfect use, basically, as it says, is you use it as it's said to be used. So if you're taking a pill, same time every day, 24/7, 365. And then typical use is I forget a pill sometimes, or if the patch or ring and maybe I replace it a day or two later. And with the fertility wellness method and pull out, like maybe not be on track of tracking things every day or forget to withdraw sometimes. And so that's why some of those are further down on the list, is because they have a kind of wider range of how efficacious they are. So to quickly go over the top, we have the implant, the IUD, the copper IUD, and sterilization. Copper IUD is hormone free can be put in, and you can have it up to 12, I think even 15 years, which is crazy. And it's really popular for a lot of women who are older, who've already had kids, who don't want to go through tubal ligation, this is sterilization, or for the partner to go through a vasectomy, because you can have it for a large part of your life. IUDs, here this is Mirena, is the most common one that we see in the US, there's also Skyla, are progesterone only. So is the implant, it's progesterone only. And so these can be left up to 5 to 7 years. And the great thing about it is you set it and forget it. It's like a slow cooker. It's just there. You don't have to worry about it, which are great. They are internal, and some people feel uncomfortable about having something inside of them. But there are low amounts of progesterone, and we'll talk about the side effects of those shortly. And you can see the IUDs, the copper, the hormonal, and the implant are just as effective as sterilization, which I think is just crazy. And then the next on the list is the pill, the patch, the ring, and the shot. The shot, also known as Depo-Provera, is progesterone only. You get it every 3 months. And then the ring is something you put vaginally up against the cervix, as we talked about. It's a combination that has estrogen and progesterone in it. There's a new ring we'll talk about shortly, but these ones you'd have to get a new one every month, as you would like a pack of pills, and replace it. The patch is something you change every week. It is visible, so you can see it on the outside. And then the pills, you can have either just the estrogen progesterone mix or just the progesterone only pills. The next, pulling out, also known as a withdrawal method, fertility awareness method, is tracking your cycle and your basal body temperature, and sometimes your cervical mucus. And then, as we know, that condoms are great for STI prevention, and we have female condoms like diaphragms or internal condoms. Next slide. So updates. There are 3 things I'm super excited about. One is the Annovera, the 1-year reusable ring. This is really, really cool. So like I said previously, you'd have to get a ring, you put it in, you take it out every week, and you have to get a new one. This one, you can wear it for 3 weeks. So you put it in 3 weeks, set it, forget it, take it out for a week, have a breakthrough bleeding, so you have your menstrual cycle, and you can keep it, store it in the fridge in the house, and then put it in again, which is great. One, you don't have to get a new prescription, you don't have to ask for refills. I think it's really, really great. And it's up to 96% effective, and that's for perfect use. So you're using it as prescribed. Some things, I'll talk about side effects with rings, and some people do have increased amount of yeast infections. So if that's a thing for you, you might want to think about a different method. And some people have increased amount of vaginal discharge. A lot of people say they can't feel it during intercourse, and that's a great method too. Diaphragms historically had to go into an office, get this fit, had to be specific to you, and now they have like a one size fits most, I think everyone. I think it's pronounced the Kea. I might be getting that wrong, but this very spaceship-like diaphragm, I think, looks really cool. It's made of silicone, which is awesome. And it's very effective, similar to other condoms, 86%, or kind of internal devices. And it's not good for preventing against HIV, but great for STIs. And you can use spermicidal gel. It's something you would put in before intercourse each time. So it's not something you wear all the time. And then this one I'm really super stoked about, the progesterone only pill. This one, so we haven't talked about this yet, and we will shortly. Progesterone you need to take on time every day. So when you're taking the pills, if you miss a few hours of taking the pills, it can really increase your risk of pregnancy. And that's a hard thing about progesterone only pills. This one, not the case. So you take 24 pills and you have a 4-day break to have your menstrual cycle. And you can forget a pill, within 24 hours, and it's still very efficacious at preventing pregnancy. So previously, if you took a progesterone only pill at 9 a.m., the next day you forget and take it at 12 or 2, it does increase your risk of pregnancy. For this one, you can wait all the way until the next day or a few hours before, and it's just as good. So those are really exciting new things in the market. Next slide. So side effects, we always think side effects are bad, some are good, and health conditions to be aware of. So these are things, I know they're very busy slides, just really to go over, to think about when choosing your method. And we'll, at the very end here, I'll kind of try to pare it down so you can have things to think about when you're deciding what's the best method for you. So the combined hormone types, this is the pill, the patch, and the ring, estrogen and progesterone. They're really great at reducing risk of cancer. So this is colon cancer, endometrial cancer, ovarian, and blood cancers. At the same time, it does increase risk of some cancers. If you are a smoker, it'd be lung cancer, and a history of breast cancer, cervical cancer also increase the risks. Reason why people like the combined pill is people get regular periods with it. So people who like having a period every single month or so, that's really helpful for people. It's also great for protecting your bones. If you have a family history of osteoporosis, some people get cysts in their breasts or ovaries, that helps reduce those. Some people have heavy periods and bleed a lot, and this can help regulate that. People who have PMS also helps with those symptoms. So the things that people are worried about that do happen, and we have been seeing over time with long-term use of estrogen and progesterone pills, is that they can decrease some vitamins and minerals. So a lot of B vitamins, such as 12, 6, and folate, vitamin C, magnesium, selenium, and zinc, these can be replaced. So over a long period of time, we do see a reduced absorption in some of these, but people who take supplements, either it's a multivitamin that contains these, doesn't tend to be a problem. There have been some cases of people developing inflammatory bowel diseases. So if you have a family history, I would ask your provider about this. And it's really important if you do have a history of a migraine with an aura, blood clots of any types or blood disorders, high blood pressure, any kind of heart disease, gallbladder disease, or liver disease, to speak to your provider first before starting. And a big thing a lot of people ask about is, do these reduce fertility? And there have been so many studies, long, huge studies, that some they do not. And if anything, for some people, it actually improves their fertility. Next slide. This is the progesterone only types. So the implant, the IUD, the shot, the depot shot, and the pill. So the thing about progesterone some people like and some people don't like is you get less frequent and sometimes no periods. So it's a bit of an adjustment for some people. They spot a bit in between. You can't really predict when your periods are. So for some people that goes on for a few months, and then for years, they rarely have periods at all. Some people, it's a huge relief who have heavy, painful periods or kind of period-related symptoms. There is also, because the estrogen, going back to the slide, does reduce the amount of testosterone, which is great for reducing acne, and also can lower your libido with the estrogen. Because that doesn't happen so much with the progesterone, people tend to have a little bit more acne and a little bit more weight gain. Not for everyone, but for some people. And if you have any problems with the estrogen related symptoms, such as, we don't need to go back, that's fine. Such as clots, heart disease, and migraines, you can take these methods. Again, there's less effect, or I don't think that there's any effect on the bowel disorders or vitamin or mineral absorption. Again, no effects on fertility except for the Depo-Vero shot. Not effects on fertility, but if you do get the Depo shot, it does take a long time to get pregnant afterwards, sometimes up to 10 months. So it's something that's important for you in the immediate future. It might not be a best choice for you. The shot is also really good for reducing endometrial cancer and for people with endometriosis. Like I said before, the progesterone pill, you have to take it on time. When you take the pills, these ones, the newer one, obviously less so. And the opposite for timing is the implant IUD. Like I said, set it, forget it. It's in, you don't have to worry about it for years. And medical conditions for progesterone only, if you have a history of lupus, seizures, HIV, or breast cancer. And the progesterone pill is what we use for emergency contraceptive. So whenever you go for a Plan B, Ella, that's what it is. It's progesterone. And how it works, it's not an abortive medication. A lot of people, there's been a lot of really news going around about IUDs and the pills, all these things that are causing abortions. It's not the case. What they do is they actually they stop ovulation. So if you have intercourse, it's unprotected, you're worried about getting pregnant, you have to have released an egg during that time, a few days after or at the time when you're having intercourse. And so taking the progesterone is going to stop the ovulation from occurring. And same with IUDs. People are like, oh, I've heard stories of people getting pregnant with IUDs. Again, like what they do is they're preventing from the ovulation from occurring and not allowing the sperm to get through. So how they work is they kind of make the area, what progesterone also does is it makes the cervical area, the top of the uterus, thick with more mucus, and so it's harder for sperm to travel. And so they don't prevent implantation from happening. So next slide. And the non-hormonal types, so the copper IUD, great if you have a contraindication for any of the hormone stuff we talked about previously. Some people have very heavy periods, fibroids, or history of pelvic inflammatory disease, and these are contraindicated because some people say with the copper IUD they get very heavy periods and they do bleed heavier and longer. Not everybody, but some people do, and that's why there's this. It can cause an anemia long term, so people do bleed sometimes a bit more, and that causes blood loss. It's a fantastic emergency contraceptive. So a lot of people don't know, if you can't take progesterone and you're worried about having a pregnancy, you can have the copper IUD put in, and it's really, really effective. Because what the copper IUD does is it does create a little bit of inflammation in the cervical area, so it doesn't allow implantation to happen. And also copper is a natural spermicidal. So when the sperm come in, it actually takes away the top of the sperm that allows implantation to happen and slows them down. And there's no STI protection. Condoms, great at protecting STIs. I say STIs and STDs. These are infections, not diseases. The condom's good for HIV prevention. Sometimes people have discharge and local irritation. So the family awareness method, the FAM and withdrawal, they're really, really great to use for people who have regular cycles. You're like, I am on time, like a clock, like the seasons every single month. My period starts 27, 28, 30 days. I just know it like clockwork. Those can be really helpful. And they are lower on the pregnancy kind of prevention. And I think a lot of that has to do with people's regularity and use of it. And the fertility awareness method can be up to 96% effective if you're regular. And it becomes more effective if you if you use in combination with both. So if you're worried about a period of time where you could be ovulating, people use withdrawal method and condoms, and they can be really, really helpful. And I think it's really great for women to understand when they are ovulating and when they can get pregnant, and can help them decide about the certain types of sexual practices that they will be having, or types of relationships that will be happening. And the last is sterilization.
You make such a good point. I just want to say about the apps. I think a lot of people are using apps now, whether they're trying to get pregnant or prevent it. But I just want to reiterate your point about, you have to have a regular cycle, and then be tracking it so consistently. And I think that's just an important note to make, because I think many of us, actually most people, I think, don't have a regular cycle. So anyway, just something to remember.
Yeah, for sure. And I think it's good to know and track. And I totally encourage all women to have some type of tracking, just so you know when your period is, sometimes keeping track of your symptoms. Just a great way to get to know your body well. And when you do have conversations with a provider, or you're ready to try to have children, you can say a lot about your cycle, and it's really helpful for that practitioner to give you information. So I think these apps are helpful. And as Brittany mentioned, it really is only efficacious if you have a regular cycle. Sterilization, so procedure, you have to go and have it done. And it's permanent. I should put that in like loose quotations. So tubal ligation, or having your tubes tied, they can grow back. So I've actually met a lot of women who've had this done early in life. They had kids in their 20s. Or early 30s, and they're like, okay, I'm done. I've had all the children, just tie my tubes. I want to be over with it. And tubes actually do grow back. I think it's incredible they do. And so a lot of women are confused of like, how did I get pregnant in my 40s? My tubes were tied. So it's something to think about. So sometimes combination with, if you do have a long-term partner in those situations where, the vasectomy and the tubal ligation together is a good combination. And they can, a lot of women tend to pick, who are concerned about that, especially early in their life, like the copper IUD or the other IUDs, because they last for so long. So you can have the IUD and the copper one for 15 years, and it's actually more efficacious than tubal ligation, which is crazy, but that's how it goes. So next slide. Oh, my favorite slide. So this is kind of a summary of going over those side effects, good and bad, healthcare method or the healthcare conditions that you have, that will kind of help you guide how you make your choice. So I think it's great to take some time and think about, like, who am I? Like, honestly, who am I and what is really right for you? And the method is right for you is the one that you're like super jazzed about. You're just like, I'm so excited to try this. I'm going to give it a good go. I think it's really great for me. And the big thing is you're not married to any of these methods. You don't have to do it for longer than you feel comfortable. And if you go in to see your provider and said, I tried this, it doesn't work out, just change it to something else. There are lots of things to go out there and try. Try it until you don't like it anymore. Or if you want to do something forever, keep it up. And if your provider says no, you find another provider, someone who supports you, someone who really listens to you, because that's the most important thing. We talked about the typical versus perfect use. And a lot of that comes down to women not feeling really convinced or really kind of on board with their use. I mean, if you don't like something, you're not going to use it that well, and you're not going to be committed to using it. So for if it's, hormones are a big thing for you and you don't want to take the hormones and all the other options don't work, like some women who have regular cycles use the fertility wellness method with condoms, with barriers and withdrawal, and are like so committed to that, and it works for them. And then for a lot of people, the copper IUD, like, I bleed a little heavier, but you know what? This feels great for me. I don't have to worry about all those side effects, and I don't have to worry about it for years. And so when you create that kind of story for yourself, and it feels like it fits your values, it's something that you're going to be committed to, and it's really going to help you with your goal, which birth control is all about, is choosing when you want to have kids. So do you want to have them 5-10 years down the line, 20? I mean, the one that you don't want to have to be caught off guard and thinking about, I'm pregnant and what our choices are. The whole point of this is giving us a choice to choose when we want to have children. So perfect use, typical use, like I said.
Or if you don't.
Or if you don't, we don't have to have children. Exactly. And that's a big thing, is like, these are great things to have if you don't want to have kids. All choices are right. The right choice is the one that's right for you. And as we mentioned in the history before, no one can tell you otherwise. There are so many organizations in society who want to say, what you should and shouldn't do with your body, and that's not up to them. It's up to us, your family, your traditions, and what's personal for you. So these are some of the things you can ask yourself, like, are you a typical user? Are you a perfect user? Hormones versus no hormones? Are you worried about your period and period-related symptoms? Are you worried about these side effects? Are you a set it and forget it kind of person? And if you're really like, no, pregnancy, please, I don't want to ever have kids, there's other options for that as well. So in summary, last slide. Oh, there's two more. I remember that. There's one more slide after this. So this is a great tool on the Planned Parenthood website. Going back to that previous slide, we can kind of toggle. You can kind of click these little buttons here, and it'll show you all those methods. So if you want help with your periods, or you're worried about hormones, it'll present with you all the methods and goes into far more detail than I went in today. I think they have cool videos. They really go in depth about side effects. Really go in depth about how they're used and what, your healthcare conditions you should be concerned about. So if you want to go and you want to kind of play a little bit around with these different options, the doctor nurse required, I think it means like you have to go into a clinic like the IUD or implant to have it done. But I found this is a really helpful tool for people who want to spend some time exploring what's important to them. Next slide. So on the last slide, I am a huge music fan, and Loretta Lynn is one of my country music icons. And in 1975, she released this music hit called The Pill. If you haven't listened to it, I highly encourage you to go onto YouTube after this, Google it and listen to it. It's such a fantastic song. The lyrics are just incredible, especially for that time. And also to think in 1975, it was banned. She tried to play this on country music radio stations, and they wouldn't allow it. I think some Alabama minister said that it was like sacrilegious and it was like abomination. I mean, this rhetoric. And what happened is word got out about this song, and women demanded, went to the radio station, said, play this song, I want to hear it. And it started to get played, and it was a huge hit. It made it on the top country music albums. And later, Loretta Lynn was interviewed, and she said that a lot of physicians and medical providers came up to her and said that her song had more influence in sharing contraception and information about contraception in rural areas of America than any physician ever had in their distribution of their medical information. And so for this, what it represents for me is us as medical providers can only do so much. And it's really the people who use birth control. It's you guys out there. You're the ones who change the world, who demand what we need, and what's important for us. So it's really important for you to speak your voice, share your stories, and uplift women everywhere. So that's really it for me today. Please send in any questions that you have.
Gosh, Molly, that was so helpful, and there was so much information in there. I will be, just to let everyone know, we're going to go through some questions, and then, but this will all be posted in the community, as well as Loretta Lynn's video, or her song, and then we'll also have an opportunity to, people can follow up with you afterwards and ask questions, because you do have a profile in the ELANZA community. So anything we don't get to today, I know we've gone a little bit over, but Molly has made herself available on the community to answer any further questions. But with that, let's start off with some audience questions. The first one is, does long-term use of hormonal birth control have any effect on fertility? I know you mentioned this a little bit, but maybe you can also potentially cover, I think a lot of questions are around if someone is taking hormonal birth control and they go off it, does it take a while to kind of get back on a normal cycle, menstrual cycle?
The answer to that is no for most all hormonal control. The only one I mentioned before is the Depo-Provera shot, which is a progesterone-only shot. That has shown that people take many months to get back to a regular cycle and to get pregnant. With the estrogen progesterone patch ring pills, as soon as you stop using them, within a day or two, you can get pregnant. So fertility resumes very, very quickly. With the progesterone only, people do notice that their cycles can take a little longer to get back to normal, and it's very person dependent. So as I mentioned before, progesterone can have the spotting, regular periods, stopping periods, and it really is dependent. I've had some women who stopped progesterone only and their periods cycle back within a month or two. So very quickly, and some women it's 6 months and sometimes up to a year. But that doesn't have to say that it's not that they're not ovulating. So that's the big thing, is a lot of women think that my period means that if I'm not having a period, I'm not ovulating, I'm not producing an egg, and that's not always true. And so sometimes when you stop progesterone, it's obviously easier to try to get pregnant when you know when your period is, and you still could be ovulating. So a lot of women do have regular intercourse during those times, even though the periods are drawn out, and are still able to get pregnant. And there's been a lot of longitudinal studies that have shown it hasn't affected fertility long-term. So women who've taken pills or implants throughout their whole life. So from they were in their teens all the way until their 40s, 50s, 60s, and haven't had any effects on fertility and also health. So I hope that helps.
Interesting. One thing you mentioned, which I think is also important to mention, is just that it can actually reduce absorption of certain nutrients, or you mentioned the B vitamins, specifically folic acid or folate, and zinc and magnesium, all of which are important for maybe not fertility, but egg quality. So just if you are trying to, if you're going through fertility treatment or you're trying to get pregnant naturally, definitely make use of some supplements. But yeah, I think that's actually great news. I think there's been a lot of confusion around that question. Yeah. Okay, so the next question is, I currently don't have a partner. Should I take birth control anyway?
And I say it depends. I would say so one thing I didn't mention a lot about is emergency contraception, and we mentioned it briefly. I'm a big fan of just having it at home. So if you really don't want to get pregnant, and you don't have a partner, or maybe you have a new partner, I recommend talking to a provider and say like, hey, can I just have some emergency contraception at home just in case? I think it's a great kind of tool emergency kit to have around. And a big thing about sex is a lot of times it happens when we're not planning for it. And that's kind of the beauty about sex too, in a lot of ways, is sometimes we don't want to plan about it, and it's spontaneous and it's fun. And the last thing you want to think about when you're in the moment is, oh crap, am I going to get pregnant? Do I have a condom? And I know these times are very different in COVID times, and I think there's maybe a little more planning that goes involved, but I think having a method that you're committed to, like I said, and you're really, jazzed about, it can be great to kind of have that on board and already taking, so you don't have to worry about it. So I think asking yourself where you're at, like, are you dating right now? Like, you might be meeting people. It might be worth to just be on a continuous birth control that works for you, and you're not too worried about side effects, and just continuing that. But if you're like, nope, don't want to date, it's girl time, it's me time, I want to do my own thing, I think you can wait and have at least something in your kind of wheelhouse emergency section. So if anything does happen, you're prepared.
Yeah, I think that makes a lot of sense. All right, so next question is, I am on birth control and my period has stopped completely. Should I be worried?
No. I think there's so much about our period, and shouldn't be worried. So I think people are worried, like, does it affect my fertility? Is there something wrong with me? Is this changing my anatomy? And like I mentioned before, we're really mimicking what the body does naturally. This is what happens during pregnancy. And we're mimicking the same systems that have been going on for a long, long time. Another thing I could get crazy and talk about forever is our menstrual cycle. We are one of the only mammals on the planet Earth that has a menstrual cycle. Some primates, a few mice, a few bats, I think, have a regular menstrual cycle. All other mammals and animals don't. It's actually on demand. And some of them actually reabsorb the endometrial layer when they don't implant or have a pregnancy. So it's something that we've developed. We don't know why. There's a lot of hypotheses out there, maybe something about the placenta and it, being more safe internally or something along those lines, but it doesn't necessarily, mean there's something wrong with you. And I think that's an important thing to keep in mind. I know, it's a really thing to keep in mind. It's a very natural thing that we're doing, mimicking a natural cycle. And it can be really helpful because sometimes having regular periods can be a problem. There's lots of heavy bleeding, a lot of pain. So for a lot of people, it actually can be a huge pro.
Interesting. All right, last question. If I became pregnant while using hormonal birth control, is there any chance my child could have abnormalities?
No. So as we mentioned before, that's a huge concern for people. People worry about having IUDs. Is it going to cause any types of changes to my developing, child? And no, like I mentioned before, what these are really doing is they're releasing hormones that are mimicking our natural cycle and don't really get in the way of development of a child. And a lot of times when you're taking it in the early development phases and people realize that they are pregnant, it's really too early to have really any kind of lasting effect, if anything, even though it doesn't, on the development of the fetus. So it's really safe to take. And if you're concerned about pregnancy or you have an IUD in place and you get pregnant, which is very, very, very rare, or taking the pill, it's okay that you've taken a few doses of it. And then once you just continue taking it.
Okay, that was the last attendee question, but I have one. Why isn't there a male pill?
It's a great question. I'm so glad that you asked that. It's really, really great. There are forms of male hormonal contraception pills or male contraception. And there have been studies that show that they're really, really effective. So they actually really, really work.
Why is no one taking them?
We can talk about societal norms. And we can talk a lot about.
It'll be a separate conversation.
Oh yeah, that's gonna be a whole podcast in itself. I want to do a series. We can talk about male forms of contraception. And I think I don't know if people have read the studies when it came out, the men were not too jazzed about the side effects. So a lot of the side effects were, surprise, surprise, mood changes, weight gain, skin changes, a lot of things that we have been enduring for many, many years.
Oh, right. Okay.
And I think a big thing too about male contraception is it's there. And I mean, if you look at the timeline of we've always needed birth control, and it wasn't until the last, 100-ish years that we've kind of created these new methods. And it took time, and it took a lot of not only, us, we were always demanding it, but it took a lot of societal change and our perceptions about contraception. So I think I'm a very half full kind of person that there will be male contraception. These will be available out there because guys actually do want to get involved and want to help. I think that's changed a bit too. And a lot of men like, okay, I want to prevent pregnancy as well. I think a big thing too is because it doesn't affect their bodies. They're not the ones getting pregnant. And so I think that's a big thing.
True.
It's hard to drive and to motivate that to happen. But I feel like in the next maybe 5-10 years, we might see more of that in the market. Fingers crossed.
Well, based on your historical view, I mean, things are moving pretty quickly. So 5 years maybe won't be so out of the realm of possibility, huh?
For sure.
Well, Molly, this has been so helpful, so insightful. I thought I knew most things, and actually I know so little, it turns out. So thanks for joining, and join us in our next event coming up soon. Thanks again, Molly.
You're welcome. Thanks, Brett.